Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Real glad that you could join us for another segment. Going to be speaking this morning with Dr. Sheri. She's a best-selling author and certified physician executive. She's joining us here on the program to talk about her personal breast cancer story and her partnership with medtech company ImpediMed. Welcome to Health Professional Radio, Dr. Sheri. Thank you.
Thank you for having me. It's a pleasure to be here.
Give our listeners a bit of background. I, of course, mentioned that you are a best-selling author and a certified physician executive. Give our listeners a bit of who Dr. Sheri is, and then let's talk about your story and this partnership.
Wow. Okay. Well, Dr. Sheri has been a physician for nearly 30 years, born and raised on the south side of Chicago, has been a part of health disparities all of her life because she was a victim of the disparities within the health arena and decided she wanted to be a physician so that she can give back to her community, help others. And I was in practice for nearly 16 years, was diagnosed with breast cancer, had some subsequent complications, and had to completely reinvent myself, come out of clinical practice, and have started a new path on raising awareness about breast cancer and lymphedema.
Do you have a family history of breast cancer?
I do not. I was actually the first person in my family to be diagnosed with breast cancer. At the time that I was diagnosed, I was the healthiest person in my family. Really? I thought I had done everything right. My main risk factor was being a woman. And at the time that I was diagnosed, it really threw me for a loop because I had rendered the diagnosis on many, many occasions and had recently just walked two colleagues and friends through their own breast cancer journey. And literally, after having passed the baton in April of 2008, October 1st, 2008, that was when I found the mass myself and was subsequently diagnosed.
You found the mass yourself. Would you consider your breast cancer detected very early? Wow.
Well, yes and no. I had my baseline mammogram done in February of 2008. I had just turned 40 in December, had my mammogram in February, and it was negative. It was read as negative. And so because I had been performing my own breast exams since I was 20 and doing it on a monthly basis, I chose the first of the month just because it becomes my constant reminder. And when I found my mass, actually, the moment that I touched it, I knew it was breast cancer, and not because I'm a pessimistic person. I am not. I am one of the most optimistic, faith-filled people that you could possibly meet. But I know my body, and so I knew that something was wrong. And fortunately, because I had walked those other two colleagues through, I had a whole host of breast surgeons in my Rolodex, plastic surgeons, medical oncologists, radiation oncologists, and so I had the opportunity to pick amongst the best. And so I actually called who I had made up in my mind would be my breast surgeon at home that evening at 9 p.m. at night. And when she examined me, we thought it was early. It felt really small. And in her mind, remove the lump, maybe have a few rounds of radiation, and then it'll all be done. But what turned out, what was supposed to have been a lumpectomy and maybe a few rounds of radiation turned into a partial mastectomy where they removed half of my right breast. A level 1 lymph node dissection where they removed 16 lymph nodes, 3 of which were positive for cancer. And then I underwent 15 rounds of chemotherapy and 33 treatments of radiation. So although my mass was small, it was growing directly back towards my lung. And so it felt small to the touch, but it was big in the sense that it was more linear and growing back towards my lung. So had we not found it, had I not found it, had I not acted immediately, that following summer I wouldn't be alive. I wouldn't have made it.
Is lymphedema a direct result of having breast cancer, or is it something that can form prior to breast cancer?
Well, there are two forms of lymphedema. One is primary lymphedema. That's congenital. You're born with it. We don't understand the full cause of primary lymphedema, but secondary lymphedema is something that you get as a secondary insult, if you will, secondary to something else. And we know that cancer in and of itself can invade the lymphatic system, but then there are certain cancer treatments like surgery, radiation, chemotherapy. All of those can damage and block the lymphatic system. I had all three. And so when you block the lymphatic system, what ends up happening is you end up with this buildup of lymphatic fluid. and it causes painful and at times debilitating swelling of the affected limb. And that was what happened to me. I ended up 1 year after my treatment was all done, I ended up with this debilitating swelling of my right arm, hand, and fingers, and I'm right-handed. And the swelling made it impossible for me to perform the clinical functions of my job. And it entailed me going through 4 months of physical therapy where I had to learn how to do manual lymphatic drainage, taping, wrapping. It was very arduous, only to end up with, after 16 weeks of therapy, being relegated to wearing compression garments, which are the mainstay of treatment for chronic lymphedema. Wearing compression garments pretty much 24/7 in order to control the swelling, because if swelling gets out of hand, you get a laceration or you get a cut or you get a burn, that limb can now become infected. And if that infection is not treated immediately and under control, that infection can spread to your bloodstream. Spreading to your bloodstream makes you susceptible to something called septicemia, and you can die. So it's no joke. It's not just quote unquote some swelling. It is a serious disease that an individual, once they get diagnosed with it, once it's stage 2 and non-reversible, it's a chronic condition that you have to live with for the rest of your life.
How is it diagnosed other than the symptoms that you described with the severe swelling, debilitating and painful swelling? Can it be diagnosed before the onset of such horrific symptoms?
Yes, it can. Here's the thing. When I was first diagnosed, my radiation oncologist was the first person to even mention the risk of lymphedema to me, and she told me it was about 1 to 2%. What her and I didn't realize at the time, it's way larger than that. 1 in 3 at-risk cancer patients will develop secondary lymphedema as a result of their cancer treatment. And usually about 50% of them will develop this lymphedema within the first year after their treatment. And what's sad is that most patients, they don't experience symptoms until the swelling has developed, which can make it too late for prevention. And once it has reached stage 2, it becomes a chronic condition, like I stated before, that someone will have to manage for the rest of their lives. So the beauty of lymphedema is that it develops in stages 0 to 3. If it's caught early in stages 0 and 1, it's reversible and can be treated with simple at-home care, putting on a compression garment for 4 weeks. Voila, you don't have to deal with chronic debilitating lymphedema. And so it can be diagnosed and caught early. And so the beauty that patients have now that was not at my disposal at the time that I was being treated and diagnosed is that there is new technology that is available now that can detect lymphedema in stages 0 and 1 when it is still reversible. And then individuals don't have to live with this chronic debilitating disease for the rest of their lives because, individuals like myself, you can be completely stripped of your career, something that you've wanted all of your life, and then now just to have it, stripped away from you, or the additional financial burdens of buying these compression garments. I mean, compression garments can run you hundreds, if not thousands of dollars a year just to be able to treat yourself properly the way you need to be. Buying new clothes because your sleeves don't fit. It fits the left arm, but not the right. And so all of these other nuances and psychosocial impacts of lymphedema that we as physicians and certainly as patients don't have any clue about, now we have the opportunity to prevent an individual from having to live with the fact that one disease, breast cancer, causing another disease, lymphedema. We don't have to have that testimony anymore.
And that is why it's so important to raise awareness of lymphedema. And last month was Breast Cancer Awareness Month, was it not? Yeah.
Yes, it was. Yes, it was. And I'm grateful for companies like ImpediMed for standing up and stating, you know what, this is Breast Cancer Awareness Month, but we are additionally concerned about not only raising awareness and educating individuals about breast cancer, but we want to take it a step further and leap into their survivorship, because we know that at the end of their treatment journey, there could be a devastating impact awaiting patients if they don't understand what could be on the other side of their treatment, one, and then two, if they don't know how to ask the right questions to empower themselves and gain back their control, to actually demand and go to facilities that may have this particular device that could detect lymphedema at a reversible stage so that now they don't have to live with this chronic sequela.
I heard you mention ImpediMed earlier in your statement there. Give us some insight into the Live Today Foundation that you launched. Let us know what was behind that launch and talk about the collaboration with ImpediMed.
Okay. Live Today was born out of my vision of seeing so many individuals impacted in this country and abroad. I stated earlier how I was stripped of my career. I could not practice clinical medicine, and I admittedly had a couple of months where I was severely depressed. I mean, I wanted to be a doctor ever since I was 2, and so now all of a sudden that's gone. I had to figure out a way to reinvent myself. And part of that reinvention was me starting my own healthcare consulting business, and secondly, becoming a international professional speaker. I am a certified speaking professional, which is the highest designation awarded by the National Speakers Association. There are about less than 600 of us in the world. But during my travels, I'm seeing so many cancer patients and survivors living with lymphedema. One, either they didn't even know what they had, they just thought it was quote unquote some swelling, or two, they knew what it was, but they couldn't afford the treatment, meaning the compression garments or, going in for physical therapy. They couldn't afford what it took for them to be properly treated. And so seeing this, especially amongst the minority population and the underserved population, I felt compelled to do something. And so I started the Live Today Foundation, which does 3 things. 1, we educate physicians and other healthcare practitioners on how to properly diagnose lymphedema and make them aware of the psychosocial impacts of the disease. Making them aware of the psychosocial impacts is important because it allows the physicians to now give the patient the resources that he or she needs. And so if there are some financial resources, it allows the physician to think about maybe some nonprofits or grassroots organizations or something with social work to help them get the resources that they need to financially to be able to address their disease issues. Psychologically, maybe they need to speak with a counselor about what this lymphedema is doing to their lives. I mean, putting on a garment every single day is just a constant reminder of your disease process. That's a lot for a person to have to take on, especially when he or she thought that once they got past their treatment, they were done having to deal with this disease, right? Number 2, we educate patients about the importance of treatment. It is not just some swelling. Your life is still at stake. It needs to be appropriately addressed. And then number 3, we provide free compression garments to under-resourced cancer patients and survivors living with lymphedema. And now the beauty of this organization, 1, it is national. We can be international. We just haven't had any international requests as of yet, but we nationally are meeting the needs from the East Coast to the West Coast, from the North to the South, with sending out compression garments to under-resourced survivors and patients who need them. The beauty of ImpediMed is that they have a desire to not only, like I stated, bring the awareness about various cancers and educating about the process. There is a desire to address survivorship. And they happen to hear about the Live Today Foundation, was able to see what the mission was, and really realize that it aligned with their same mission and values. And that is, one of them, to bring an end to lymphedema, to bring an end to this chronic debilitating disease that is affecting 300 to 500,000 new cases of secondary lymphedema will be diagnosed in the U.S. every year. Every year. Just think about that. There are more than 5 million cancer survivors living with secondary lymphedema in the U.S. right now. Imagine if that 5 million individuals, imagine the percentage that are like me that had to give up their career. But imagine the percentage of individuals that weren't able to reinvent themselves, that weren't able to turn things around on a dime and actually be able to contribute back to society. And so ImpediMed reached out to me, and we figured, you know what, we can merge and pull together a wonderful partnership, because ImpediMed has a device that can be used as a clinical assessment tool to diagnose lymphedema stages 0 to 1. Lymphedema, as the Live Today Foundation can provide those compression garments. Remember, if it's caught in stages 0 to 1, Live Today can be the provider of those compression garments that they need to wear at home for the next 4 weeks. And again, we're working together to educate the healthcare community as well as patients on the importance of gaining back your control, living out your full survivorship with decreased morbidity, and really being able to enjoy life on the other side of treatment.
Well, Dr. Sheri, give our listeners a website where we can learn much more about you, about ImpediMed, and about lymphedema as well.
Well, to learn more information about myself, you can visit my website at www.drsheriMD.com. That's DRSHERIMD.com. If you want to find out more information about ImpediMed, you can visit their website at www.ImpediMed.com. That's ImpediMed.com. And then finally, if you want to find out more information about lymphedema and the Live Today Foundation, you can go out to www.live-today.org. That's LIVE-TODAY.org.
Dr. Sheri, thank you so much for joining us here on Health Professional Radio this morning. It's been a pleasure speaking with you.
My pleasure. Thank you for having me.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Sheri. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.